Hello, Danielle. My name is Rhiannon Alton. I'll be one of your nurses today.
Good morning. My name is Justin. I'll be another nurse taking care of you today. Can you please state your name and date of birth?
Good morning. Yes, my name is Danielle Pace. My birthday is June 27, 1945.
How are you feeling today, Danielle?
To be honest, I've been better. This past week, I've been having a really hard time breathing, and I've been coughing often. I also feel like I'm coming down with a fever. Do you think you could check?
I'm sorry that you're feeling this way. I spoke to the doctor this morning, and it's confirmed that from your culture you have Staphylococcus aureus pneumonia.
Did the doctor explain this diagnosis to you? Like, did you have any questions?
Yeah, I've heard about pneumonia before, but I'm not exactly sure what it is. Do you have an idea how I could have gotten this? I can't really think of any. I'm very concerned and confused. My husband isn't with me anymore.
Well, Staphylococcus aureus is a bacteria that can live on the skin harmlessly around the nose and mouth area. But if you do have a bacteria like this on your skin and the skin is punctured or broken, the bacteria can enter the wound and cause an infection. Once you have Staphylococcus aureus, it can cause further complications. In your case, underlying lung disease may be what caused the infection to develop into something more.
Is there a specific treatment for this, or should I just give it some time to go away?
For a bacterial infection, antibiotics are the typical treatment. The doctor has prescribed two antibiotics for you. These are vancomycin and ampicillin sulbactam. Some strains of Staph aureus can actually be resistant to vancomycin. This is known as VRSA, or vancomycin-resistant Staph aureus. In your case, this wasn't the situation, thankfully, and the vancomycin should be enough to cure you of your infection, along with the help of ampicillin sulbactam.
Vancomycin is a glycopeptide bactericidal antibiotic used against Staphylococcus aureus, the bacteria causing your pneumonia. It works by inhibiting bacterial cell wall synthesis. Ampicillin sulbactam sodium consists of semi-synthetic antibacterial and a beta-lactamase inhibitor for intravenous administration used only to treat infections that are proven or strongly suspected to be caused by bacteria.
Have you ever taken vancomycin or ampicillin sulbactam before that you can remember?
No, is it a pill? I don't really have a memory of taking them. Could you check my chart or something?
Vancomycin is not absorbed systemically when given orally, so it has to be given in IV form. The process for administering this antibiotic will be slow, about an hour or so. This is in your best interest to prevent a toxic reaction from occurring. Ampicillin sulbactam will also be administered piggyback through the IV. The dose will be delivered in a greater diluent with 50 to 100 milliliters over about 15 to 30 minutes, 4 times a day.
I'm reviewing your chart and just want to clarify a few things, Danielle. Are you allergic to corn?
No, not at all. I like to eat corn actually with dinner when it's in season.
Okay. Corn allergies are a contraindication for vancomycin administration, so that's good. Vancomycin and ampicillin sulbactam have the potential to be nephrotoxic and ototoxic. Nephrotoxicity means that it can be toxic to your kidneys. Are you currently taking any of these medications? Furosemide, aminoglycosides, amphotericin B, colistin, cisplatin, and cyclosporin?
Whoa, those are some big names, but I'm not too sure. Could you check my chart or something?
I'm checking your chart and it doesn't look like you're taking any of those medications, so you should be good to go.
Okay, great. It's important that we know because these drugs can enhance the toxic effect that vancomycin might have on your kidneys. As I mentioned before, vancomycin can also cause ototoxicity, which essentially indicates hearing loss. If caught early, this effect can be reversed. Please let us know if you notice any ringing in your ears so that we can stop the medication promptly.
I definitely will. My hearing is important to me.
Mm-hmm. So, some other potential side effects that might occur from taking vancomycin and ampicillin sulbactam include chills, dizziness, fever, rashes, severe diarrhea, nausea, vomiting, and edema. If you do experience any dizziness, be sure to press your call bell so that we can assist you in getting up to move around or use the bathroom. We wouldn't want you to fall. We encourage you to use the call bell at any other time that you need something to make you more comfortable.
Okay, should I be worried about any of any of those things? They sound kind of scary. Is there anything I could do to help alleviate or minimize my symptoms?
When you are experiencing an upset stomach or diarrhea, I always instruct my patients to eat small meals and in between suck on a hard candy to keep your stomach settled.
We understand that the side effects can seem a little bit scary. However, it's important that you know that over the course of the administration, we will be checking the active levels of drug in your blood to make sure that we maintain a therapeutic effect. When we refer to peak and trough levels, that is what we are indicating. We will also routinely be coming in to check your vital signs, your renal lab values, liver function tests, and complete blood count tests to make sure that you're handling the antibiotics well.
Good. Okay, that makes me feel a lot better. I was kind of worried there for a second. But I'll be sure to use the call bell if I'm feeling dizzy or need any help going to the bathroom. Once I stop feeling better, can you guys stop administering the medications? The thought of having IV in my arm for a long period of time makes me uncomfortable. Like I said before, my husband isn't with me and I'm all alone.
Okay, so when antibiotics are prescribed to treat a bacterial infection, patients often notice diminished symptoms early in the course of treatment. Medication should be taken exactly as directed. Skipping doses or not completing the full course of therapy may decrease the effectiveness of the treatment and increase the likelihood that the bacteria will develop resistance and will not be treatable by any antibacterial drugs in the future.
Do you have any other questions or concerns that you would like to talk about, Danielle?
No, thank you guys. I think you covered it all. You guys were both very helpful and the best nurses I've had in a while. Thank you.